Okay, everybody, so here we are with one of our blogs this week. This one is going to be a multi-parter because we're going to be talking about task management. The first thing we're going to talk about, though, is our new patient, which makes sense because it's the first interaction we have with our patients. So when we talk about new patients, we want to talk about, specific to task management, what are the individual steps that you have to take, I don't care what specialty you're in order to make sure that something happens. And then we'll talk about whether that's effective enough or what else needs to happen. So the standard kind of regular operating mode for practices is that you take a patient's intake, so that's all of the forms that you fill out when you go to the doctor. Your insurance verification, so the front desk takes a copy of your card and your license and does the scan and calls insurance. And then you have your initial examination. So this is when you're waiting in the waiting room, and then you get called back, and then you get asked a whole bunch of questions, and then they basically do their physical exam on you, or they do a question and answer exam, whatever it is. And then you've got your treatment plan. So they discuss your options with you to either figure out what's wrong with you through more testing, or they figured out what's wrong with you and they want to try a treatment option. And then, of course, whether you do this at the beginning or at the end, some practices opt to do it at the beginning. At the end, I'll tell you what generally works out better. But at one point during the office visit, the first initial visit, you have to collect the payment or the payment method. So this is standard, and it doesn't work. The reality is that things fall apart regularly in this process. So we're going to take a look step by step where things need to be added and what things need to be added. The first one we'll talk about is your intake. So if all you're doing is taking a patient's intake forms, one, you're creating a frustration point because they're filling out dozens and dozens of forms. And two, you're not engaging with the patient at all. And, I understand, having worked in so many practices, seeing that there are other things that the staff can be doing. But what on earth could be more important than interacting with a patient, especially when it's their first time in the office? So the first thing that we want to do on intake, and we see this in some specialties, not all, is an office tour. This is generally done by an assistant. So it could be an assistant to a nurse practitioner, an assistant to a doctor, a chiropractic assistant, a physical therapy assistant, whatever it is, somebody with some clinical knowledge who can take them through the office, what services are provided, and why they're so special. So this is really important, and we want to hype community here. This is really where we have the opportunity to talk about how large a community the office has. So this is one really big part. The next thing that you want to do at intake is actually explain the intake forms. So this is where you want to make sure that the patient got an understanding of whether or not your forms are standard or there's something unique about them. And generally what you want to have is some part of the form should be unique. Whether it's a body diagram where they can just kind of check off where they feel things aren't ideal for them. That's the major one we see a lot is, you put together a human body with a gigantic neck, and basically what you have is you tell them, all right, where does it hurt, right? And so that's generally the most common unique thing that you see in practices because the image is different. The way the form is put together is different, but it's something generally unique. Most practices don't do it. So now I've explained the forms. Now at intake, what I want to do is review the next step. Now I kept this one kind of vague because it depends on the specialty you're in, but let's say that you're in a repeat specialty like chiropractic. At this point, what you want to do is review what's going to happen next at their initial exam. So in a chiropractic setting, what you're going to find is once you've gone through the office tour, you've explained what they have to fill out, they filled everything out. The next step is going to be generally an x-ray or some kind of imaging where you can see the spine and what's going on. And this happens concurrently with insurance verification. And that's the next thing you want to tell them is that we're going to need a copy of your insurance card, your license, so that we can go ahead and verify your insurance. But this next step is really crucial because, again, it brings us back just like everything else, to the power of the community, and it strengthens that power. So that's intake. And there are other things you can add here, but for lack of time and space, we'll focus on those. Insurance verification, this one's pretty simple, but basically what you want to do is, wherever you can, you want to do it electronically, and that's where basically whatever system you're using, you want to avoid the phone, because it's a waste of time and it keeps you away from the patient. You're calling and you're on the phone with people who are out to not pay you. So we want to electronically do insurance verification whenever possible, or we want to outsource that. Now, when I say outsource, a lot of people get nervous when it comes to this kind of thing, but the reality is you really don't want to be spending your office staff's time on this kind of work. Is it worth it in terms of dollars if it costs $3 to $10 per verification? Some of that's going to depend on how valuable your patient is in terms of dollars, how valuable their visit is. Generally, if it improves your new patient retention by, let's say, 10 or 15%, then yes, it's absolutely worth it. The next thing that we're going to want to do with insurance verification is we're going to want to actually talk to the patient about their benefits. So when we talk to the patient about their benefits, we're going to want to go ahead and make sure that that patient has their coverage that they understand, and it's gone through in a little bit of detail. So this is important because most people don't understand the difference between a deductible and a copay and a coinsurance and a max allowed amount versus in-network and out-of-network. They're not going to understand any of this stuff, and you're going to need to explain it at least a little bit so they understand what they're paying for and why they're paying for it. So as we go through here, we're going to kind of get an understanding of how much more complex these steps are. And just so far, you can see that, I mean, just step 1 is 3 times as complicated. Step 2 is twice as complicated, and it's only going to get more complicated after that. And the reason that it's so complex is because in order to maintain and maximize the value of your patients, you have to be spending your time building a community, and that requires more attention than what most people do. And in order to get that done, you've got to have an automated way of tracking that and triggering those tasks. And I mean, that's what POI is all about. One of our products, Vericle, that's what it does. So next time we'll pick up from there and we'll start talking about the initial exam.